Hello dear students, this is Mushtaq from MC Society Institute of Pharmacy. Today we are going to learn about antidiuretics. Outcomes of today's lecture. The student will be able to define the terms antidiuretics. The student will be able to classify the antidiuretic drugs, and the student will be able to explain pharmacological actions of antidiuretic hormone. Definition of antidiuretics. So these are the drugs that will reduce the urine volume, particularly in diabetes insipidus, which is their primary indication. Since in diabetes insipidus there will be secretion of large amount of urine, which will be around 10 liters per day. So these drugs are indicated in diabetes insipidus to decrease the urine volume production. Hence they are called as diuretics. That means they will reduce the urine volume. Classification of antidiuretics. First class, that is antidiuretic hormones. Examples are vasopressin, desmopressin, lipsrin. Second class is thiazide diuretics, which decreases the glomerular filtration rate. Example is amiloride. And miscellaneous, they act by release of vasopressin, a hormone from pituitary gland. Examples are endomethacin, chlorpropamide, carbamazepine. Next, about antidiuretic hormone. As we know that hormones are secreted by endocrine glands, and pituitary gland is the endocrine glands which has two lobes, anterior lobe and posterior lobe. So this hormone, antidiuretic hormone, is secreted by posterior lobe along with oxytocin. So the rate of secretion of this hormone, that is antidiuretic hormone, is mainly depend on the state of hydration, whether you have a good amount of water in your body, then it will increases the secretion if there is requirement of water in our body. Basically it stops the excretion of water from our body. Next, pharmacological actions of antidiuretic hormone. First, on kidney, the distal tubule and collecting tubules of nephrons become permeable to water, leading to absorption of more amount of water from tubules, and thus results in the reduction of total urine volume. So because of absence of this ADH hormone, there will be no absorption of water from distal tubule and collecting duct, and the water will be eliminated in the form of urine in large amount, approximately 10 liters per day in diabetes insipidus. Next, on cardiovascular system, a large dose of ADH raises blood pressure by direct stimulation of vascular smooth muscles. This is followed by fall in blood pressure due to narrowing of coronary blood vessels, which are supplying blood to the heart, and by direct depressant effect of ADH on myocardium. So initially there is an increase in blood pressure because of the blood vessels will get narrow. Because of narrowing of blood vessels, there will be increase in the pressure. Simultaneously, the heart functioning will get slowed down, that is depressed, by narrowing the coronary blood vessels, which causes the fall in blood pressure. And on other smooth muscles, in large doses stimulate the smooth muscles of gastrointestinal tract, causing increase in peristaltic activity. Peristalsis means movement of food in the GI tract. There will be increase in the motility of GI tract. Pharmacokinetics. ADH should not be given by oral route, as it is destroyed by trypsin in the small intestine. Hence it is administered by parenteral route. Therapeutic uses, it's mainly indicated in diabetes insipidus. Secondly, bedwetting in children and old ages to stop the urine or micturition at night time. Next, last, in hemophilia disorder. So these are the uses of antidiuretic hormone. What we have learned today, we have learned that antidiuretics are the drugs which reduce urine output. So antidiuretic classification, and next is pharmacological action of antidiuretic.